All this is Dr. Mobeen Sayed from drbeen.com. Welcome to the second show for today, our random chit chats. So Steve is first. I always have to look right away to see who is first. So Steve is first. DDS says first, but really from my scrolling here, DDS is second. Jim says second as well. Denise says yo. Emily says third. Jenna says hi. All right. So guys, how are you? What did you think about the AstraZeneca's dosage and efficacy data? Melanie says first on Facebook, welcome. Angela says hello. Please remember tomorrow we'll have Dr. Paul Marek with us, and we will have him at 4 p.m. instead of 6 p.m. So 2 hours early. He is on the East Coast, so it becomes very late for him. So I volunteered to say we can do it early because he has been so nice that he has been adjusting his time every time. What he does is hour 6 is his 9. So he goes from home to his office back and then does the session from office and then goes back home. So I think that was a lot of trouble. So I offered him to do it early and he accepted it. Shahida says, Islam, I'm in Mumbai. Walaikum salam. Very good presentation on AstraZeneca. Jan, thank you very much. Rima says, I'm so excited. Thank you. I love Paul Marek as well. Yes. Like button, yes. Zigzag, yes. Like button. Don't forget to like all of my videos. Even if you're not watching, just go and like them all. That helps. John, welcome. Joanne, welcome. Jenna, I think what time did it be worth me reading for now? It's a mess. Yes, so Jenna, I got your email. So my team member sent me your email, so I would respond to you tomorrow. Jenna, how is your ivermectin experience going so far? Yeah, to me, AstraZeneca seems just weird and weird as we keep getting more and more into AstraZeneca's days. They keep becoming strange, but there are some folks who are upset with me that I'm somehow hard on them. Yes, DDS. we should have a trophy for someone who comes who is first the most of the time in a month, and we should send them we should have a little jar for collecting our money for trophy. Jan says, always love your videos. Thank you. Hello, Drbeen and Cool Beans. Hi, Cynthia. How are you? Christy, looking forward to Dr. Marek. Absolutely. Me too. Denise, excited for Dr. Marek. Going to be a full day for me with my international Ehlers-Danlos syndrome patient advocate at CME, sir. Wow. Thank you. I hope we won't do it every day. So yes, so tomorrow for East Coast 7, not 9. So my time 4, your time 7 on the East Coast. Okay, so Jana says what time tomorrow? So 7. Robert says 9 p.m. Eastern. That's good for me too. So Robert, no, not 9 p.m. tomorrow. Tomorrow, 7 p.m. Eastern. Laura says almost first myself today. Damn. Almost there. Yes. Tomorrow you'll be first. Carrie says, cool. Another video. Thank you. Thank you. Saqib says, hi, Dr. Bean. It's Saqib Bean, fan of Mr. Bean. Thank you very much, Mr. Ben. Earlier post on YouTube. So Sepal Steve says, did you get a chance to read? Maybe I missed it. Sepal, I would check it out. So Mike says, how much K2 if you're taking 5,000? So I have a very lazy way of looking at that. I take K2 only in the RDA. So whatever is the RDA on the bottle, I just take K2 with that. I take vitamin D a little higher, which yesterday one of the Cool Beans was very upset about, and she was capitalizing her words as well. I'm sure that she can hear it and know that it was her. And she was upset that I am talking about AstraZeneca presenting the evidence while I talk about vitamin D without evidence. I'm not talking about vitamin D without evidence, number one. And number two, there's a huge difference between a vaccine and a vitamin D. I actually showed the link yesterday where they said that the calculation has to be corrected. Original calculation of RDA is incorrect, and they have the whole paper discussing that. And then there are many doctors who have their studies up that if you are taking vitamin D that is 5,000 and above, it is actually very many studies, tons of studies. So Catherine says, could we be building antibodies for the first 84 days, and by interrupting the training process you have talked about, that is, this interrupting causes the AstraZeneca observed decrease? So at this time, even me who is in love with the medical concepts, I am at a loss as well, because 84 days or 90 days is usually not for our B cells to continue to get trained. And vaccines are not something that would continue to increase in their amount. They are given and they are removed. Is it something to do with the adenovirus itself? Is it something to do with the DNA, that the DNA of the spike protein goes into our nucleus? Maybe there is some behavior there that is different. I have not seen, neither have they explained the low dose, standard dose issue. And I don't think that they know why that happened, nor is there a good explanation for this prime and booster. So sure, there are some vaccines which have a large difference between prime and booster. Maybe this is one of those kind. What is exactly causing it, at least, is not known yet from their paper. John Rias says, 6 months ago, Mr. Gartner said, if everyone took ivermectin, the COVID pandemic would be over in 2 weeks tops. Does he still feel this way in lieu of all the new vaccine? I think he does. So that, look, if we all, the whole world, just went in for 1 month and didn't come out, pandemic will be over because the virus will have to die. Where would it go? Same is a thing if you take ivermectin, virus will have to go away. Gold Country Ras says, Jana Taylor, Dr. Bean, I posted my update above. Okay, so I may have to go find it. That is correct, John. Lying Eyes says, how many deaths could have been avoided if therapeutics were allowed and given? A lot, of course. And even now, therapeutics are good thing for ivermectin, that there is not that kind of resistance as to hydroxychloroquine, but there still is resistance. So even now, so those folks who used to tell me that, hey, Fauci is not doing a great job because he is under pressure, now he's not under pressure. But do you see any difference other than accelerating the vaccine, which is fine? I love it. I am a pro-vaccine guy, so I love it that the vaccines are being done quickly. But any other difference? M. Gregory says, I try to stay home 24/7, but I get so bored. That is very correct. And remember, I had done that discussion, what is love? And in that, I talked about the norepinephrine and oxytocin and dopamine, and why it was important for people to talk with each other and hug and kiss and touch, or just being able to interact with each other is important, especially the youngsters. They are under stress. And that my video was removed as not related to COVID. So I said, fine, that's okay. Muhammad Faisal Khan says, sir, can I take steroid for just 5 days to improve my body? I have no idea. That's a very I don't know what you mean by improve your body. That is correct. So I do agree with this, that the masking has been pushed a lot. Yes. And I think that that was coming from Biden as well, because from the very first day he's been talking about mask. And that is a good thing. Given that the virus is mutating with potential changes in its spike protein structure, how would that affect its attachment to the ACE2 receptor? So, as we saw, that there are some mutations that are actually improving its efficiency of binding, or as we say, binding affinity. And then there could be changes that would allow it not to bind correctly, or with more affinity. Such viruses, such mutants will die off, and those that can continue to bind and bind with more affinity will then spread more. That is what is the selection pressure. So Samina says, I've taken AstraZeneca, second dose is scheduled after 2 months. Your opinion? So we just talked about it, Samina, that they are saying that lesser than 6 months, the efficacy drops. So let me show you the chart. So instead of my opinion, AstraZeneca seems to be a challenge to create an opinion about. So here, sorry, I'm sure that some folks are going to be upset with me. Look here. So let's say 2 months, and let's say 56 days. So that is 56 here. So according to their own chart, at day 56, if you get the second dose, then your lower bound of the efficacy is somewhere here, which is 25 to 50, about 40 something. And your upper bound of efficacy is going to be near 80. So you have a chance of having efficacy between 45 to 80. If you look at their own data once again, here, they said that 12 plus week, which is about 3 months instead of 2 months, their efficacy still, if you look at the confidence interval, it is from 32% to 69%. So the lower range is still 32%, and the upper range is 70%. Their 54% is the efficacy from this range. So if you're taking it at 2 months, at least from their own data's point of view, here is 2 months, and it looks lesser than this area. Weird. It's just so difficult to look at their efficacy data. Lying Guy says, they blame us for the deaths when it was the government and health officials that blocked the saving therapeutics, including telling doctors to not prescribe. Absolutely. The medical leadership did horrible. For example, so you, just like we just talked about it, that masks are pushed more. Trump was not pro-mask, so I think in that time, people were not pushed for masks that much. Biden is pro-mask, and so we are pushing more. So what did Fauci do on his own? Did he go to Biden and say, I think we should do more vitamin D, and let me do that too? He's just doing what Biden said. Previously, he was just doing what Trump said, and then he says that I had pressure on me. Sorry, I'm not the best fan of Fauci. Rima says, Dr. Bean, did you ever find out what happened in Israel with their reporting of wide vaccinations and yet not the kind of hospitalization drop one would expect? So I was actually reading that up today as well. Rima, give me a day to understand it more. Let's look at it together. I still have to make sense of it, but I was looking at a report that said out of 600,000 people who have gotten 2 doses, there is 94% less infection. So out of 600,000 people who've gotten 2 doses and they studied them, the infection rate is only 6%. And that is a huge drop. So, worldometer Israel. So total cases are still not coming down. If I say daily new cases, they are coming down, but rather gradually, as much as I would have expected much more. This is interesting. Active cases, if you see, they are coming down fast. And then let's look at the number of deaths are still not down. And although here, if you see, these are coming down for sure, but not fast enough. To me, it looks like they're trending in the right direction. I would have expected a little bit better or faster reduction in cases and deaths, but I still need to. I need to talk with someone in Israel. There is a cool bean who has volunteered to talk with me from there. So hopefully we can arrange a time with them and discuss more. Wayne says 90% of people 16 and older in Israel have received the first dose of Pfizer's second dose vaccine so far. Now, data collected shows that there is 41% drop in confirmed cases. Uh, I saw one more report today that 600 on for 600,000 people who have received both doses, the reduction was a lot. Yes. So, Rose, remember we said that we'll make a book club for Dr. Phillips. So, as soon as some folks come back and say we had the book and we've read it and we have some questions, I would then go back out to Dr. Phillips and ask him to join us. Nicholas says, Dr. Bean, my family got Moderna vaccine first shot on the 13th. Any recommendations to reduce likelihood of symptoms of the second shot? Don't want to take antipyretics. Just curious if any supplements help. Just have your vitamin D and vitamin C and K2 and melatonin and CoQ10 and glutathione. Correct. Even if you take them in RDA, calcium, sorry, the vitamin D should be a little bit more, but others can be in RDA. So Goldmark says, yes, the problem, as always, is the lag, the time between getting the vaccine and then the couple of weeks after, before the vaccine. Yeah. So let's see. Um, John says that can we all get together somehow, sign and submit an e-petition to the White House for the immediate EUA for Edmonton? We need this. I actually have a few doctors who have people in White House that they know them. They knew them before as well. They know them now as well. So it's not political. And they were talking with me to help them with the mechanism of action of ivermectin, and they wanted to go in. So I'm helping with that, and then possibly this idea is good as well. Laura, so Janet says, please retype your comment for Dr. Bean with question, please, before it, so he will spot it. Line plus COVID. Yes. So Laura, sometimes when the question is not prefixed with those letters, I just can't spot it in the comments. Sanjay says, question: if Pfizer and Moderna have new ITP cases, could the allergic reaction to components of missing vaccine be the cases of this? Is AstraZeneca vaccine after safer? I got this one. So Sanjay, the so far, in my opinion, because they have not owned up that idiopathic thrombocytopenic purpura is something to do with the vaccine. Because of that, we do not know what component. Although from the older vaccines, we know that this may be something to do with the um, polyethylene glycol. If that is the case, then AstraZeneca will be safer. And this is a cute comment. Colin says, is metronidazole any use against this virus? I lied to my doctor today, hoping I could get ivermectin prescribed, but ended up with metronidazole. Metronidazole is for it's an for GIT. So I don't know why he gave you metronidazole for. Maybe he thought that with COVID you'll get the GIT upset, and that is why he's trying to correct the GIT. Yes, so Carlos, I ended up doing Cineform, but Cancino is still missing. So let me just take that note as well. I had thought that I would do them together, but somehow Cancino is still behind. Gold Country Russ says, question, any difference between 21 milligram ivermectin weekly and 3 milligram daily for prophylaxis? 210 pounds. So, Gold Country, as I have discussed before, that this is one area which has not been done before. So we actually do not know what is the right way to do it. Is it the total dose divided every week and then divided, as you're saying, daily? Or is it total dose once a week or once a bi-week or once a month? I have been using total dose twice a week, once a week for prophylaxis and continuously daily during my patient's active COVID. The study that I showed for prophylaxis, that had said 2 doses only, day 1 and day 3, and done for 1 month, and then just repeat. So because of this, if I was the one, I would have, maybe you take the 21 milligram and divide it into 2 days. But again, I can't be more specific than this. And of course, I cannot prescribe it to you. This is just my thinking. I used to give the dose daily, once a week. Simple Steve says, read that bradykinin is responsible for causing the cytokine storm. Have you had a discussion? So, come on, now I'm feeling sad that you have not seen. So if you go here and say bradykinin storm, Dr. Bean, look at this. Bradykinin storm instead of cytokine storm. Is hyaluronan, is bradykinin storm actually observed? Dr. Bean, bradykinin storm is, so as you can see, I have done this talk. So Rima, the way we are working with Dr. Marek is that, number one, I have a Twitter thread where I'm collecting questions for tomorrow. Secondly, Dr. Marek would come in and present his presentation first, and then we will go to the questions. My request will be that questions during his presentations are going to be lost because they're going to scroll up. Once he has given his presentation, please keep a note of your questions. And then when he says that I'm ready for the questions, that is when we open up for questions. And then if you type it, there is a better chance for us to ask him that. So Ganesh says, good night, doc. Have you tabled all your treatment for all your pets? It will be very informative. Not yet, but good night. Patricia says, have they done a study with rifampicin? That is a good question. I do not know. We can ask them. Question, are you scared about the variants as Osterholm is? Not yet. Although if you see, AstraZeneca said that their vaccine is minimally effective for the latest B1135 variant. So It is possible that there are going to be variants that would escape. Yet, I'm not too scared of them. Jim says, question then, you cut the dosage of ivermectin in half after 10 weeks. No, so if it is prophylaxis, I just keep giving it. If it is active infection, then I just stop it once they have recovered or their oxygen saturation is back to 97, 98. Then I don't give further ivermectin. No need. Alice can calm any storm at the Brady's. Yes. Cool. So let's see if any more questions and then we break for today. Leslie says, do you still use steroids? Yes, for my patients. If I suspect that they have moved away from the viral stage and they still are breathless, or they're short of their oxygen saturation is dropped, but their symptoms are still continuing, then I give them a pulse of steroid, and I hope that they don't end up in a long haul state. Caesar says, is there any hair loss cure? No idea. So Anna says, why do you not prefer Pfizer? You should take Moderna and AstraZeneca over Pfizer. No, so Pfizer is good as well. My recall for Pfizer was that initially they had more allergic reactions compared to Moderna. They still have more allergic reactions to Moderna. So that is the only reason. Now, I am not known to have allergies other than trimethoprim and sulfamethoxazole. So if it is me personally, I think I'm okay with Pfizer as well. Frankie says, I have blood clot symptoms, but I'm afraid to go back to doctor. Frankie, you should go back to doctor if you have symptoms, because if you need blood thinners or something, that should be done in a timely way. Cool. So one more question, then we stop. This is Mariesta Dersh. I've seen you after a long time, Mariesta. What do you think about JJ vaccine? Johnson & Johnson, I loved it. I have if I go back here and say Johnson & Johnson and Dr. Bean, here, Johnson & Johnson vaccine. I thought that as soon as it comes in, then the pandemic will actually start wrapping down. That is very good to know. 2 universities in South Africa are buying with randomized control trial. Very nice. Cool. So let us break for today. We'll continue tomorrow. Remember, 2 hours earlier. And my request, Mariasta, thank you very much. I love you too. So there is one more question here. Shahir says, Sajid, scared to get Sinopharm a lot, adverse effects, especially in women here in Pakistan. What to do? Wait out for Pfizer or get it? So I talked about Sinopharm a few days ago, and they said no adverse reactions. So at least on the data that I had, there were none. Cool. So please like, subscribe, and share. There is also a link in the description to buy me coffee if you like the work I'm doing. And if you want to buy me a coffee, there is another link to become my patron if you want to support this kind of work for doctors and nurses for a long time. And then if you just wanted to support my work, there is another link for that as well. So once again, thank you very much. If you won't do anything, then at least hit like. That helps. So thank you very much. And I'll see you tomorrow at 4 o'clock Pacific and 7 Eastern. Talk to you then.